Hello, this is Dr. Shadeen Sachadina from We Mentor You. I'd like to introduce you to John North. John is a breast cancer patient. He is about to have his surgery in 2 days. And we're having a conversation about how did you tell your family? How did you break it to your daughter? And just to kind of give a little backdrop, your daughter, you said, was on the autistic spectrum as well, right? So let's talk about how did you break it to your family, and then how did you break it to your daughter?
My larger family really just, blurted it out really on text and messages and phone calls and just said, hey, because part of that conversation was, hey, do we have this in our family? Any history that I don't know about, and we learned that some cousins and
But they were distant cousins.
right, first
So
cousins.
it wasn't, okay,
Not immediate family.
okay.
But my daughter is 21. Her name is Caitlin. She is on the autism spectrum, currently a student at Seminole State. We lost her mother back in March after a long history of health. And so I knew this was going to be pretty frightening and difficult for her.
That was just a few months ago, so yeah,
Yeah.
of course.
So I wanted to be very careful with her, and one of the things I wanted to be absolutely certain of was I didn't tell her anything until after we had the biopsy and knew for certain
Yeah,
that yes, you have breast cancer. Although you were pretty confident from the very first images that you saw in
yeah.
ultrasound.
But you see, that was the thing. I was preparing you because with what I was seeing, there was over 95% certainty that this was going to be a cancer. So from your surgeon's perspective, in my mind, that's how I do things, is if I truly believe it is, as you recall, I will actually prepare you, right? So by the time the news actually comes to you, it's a little bit more, not easier to handle, but it doesn't come as much of a shock. But then it's easier to move forward with you, because patients at that point, they were like, okay, I'm prepared, she told me, let's go,
And so,
right?
anticipating that diagnosis, I bought a copy of your book. It's a children's book that Dr. Sachadina
It's
wrote.
called Me Too and Lee Learn About Breast Cancer.
And I ordered a copy online, and it arrived, and
I would have given you one.
I didn't want to do that,
Oh.
so I got it, and it's funny, it arrived. My daughter actually picked it up outside and brought it in, and she was about to open it. I'm like, Caitlin, no, you can't open Dad's packages, and 'cause I knew what it was. I didn't want her to see it. I hadn't told her yet.
Okay.
So I, because we had not at that point reviewed the biopsy. Anyway, I brought it in when we did review that information, and thank you very much for signing it.
Oh,
And
you're very
there was a beautiful note that you wrote. So I took it home and sat down with Caitlin, and it was really good that I could say, look, here's very easy to consume information about breast cancer. Dad's going to be fine. I'm going to be fine. And we got to it early, and so we had a conversation about it, and it was good.
So you used it as a tool to open that conversation with her, and it helped you?
It helped me. It helped her.
Yeah.
I was very worried about how she would respond. I mean, having just lost Mom just a few months ago.
Absolutely.
So she did ask an interesting question. I was all about assuring her, Dad's going to be fine. I'm going to be fine. Dr. Sachadina is going to take good care of me. We're going to have surgery. This is all going to be fine. And she said, well, why didn't they do that for Mom? And that was hard. And my brother was with me, and we just explained to her that, Mom, she did have a lot of help over the years, it got to the point there wasn't anything more that could be done.
I think it's really important also that she knows that that is a different problem than the one that you have. So in her mind, she can separate them because, of course, in her mind, right? Health issues for health issues. That's all she has ever known.
Right.
So I think that would be a way to maybe kind of help her and guide her in a different direction and say, yeah, but this is different. It's not the same thing as what your mom had. And maybe that'll help her.
Well, and we did. We talked through that, and I said, look, Mom was sick for a very long time, and it got to the point that there was nothing else that could be done for her. But I'm going to be fine because we caught this early, and I have a great doctor who's going to do a great job for us, and we're going to be fine. It'll be difficult for a period of time, and then we'll move on.
I think one of the reasons that I actually wrote this children's book is children really do handle things well. If you educate them, if you let them know what to expect, they will do fine. And there are actually some studies that show that children in homes diagnosed with breast cancer, in men or women, they have a worse outcome if they are not prepared. In other words, they have increased psychosocial issues, things like that, way after that whole household has dealt with their diagnosis of breast cancer. So this book was actually written to, number one, be used as a tool, kind of like what you did, to help these conversations with your children. And also, too, it's to help people understand about what is breast cancer, all in easy to understand terms. So this book is actually for ages 5 and above. And for your daughter, it was perfect because she was able to understand it at the level that she was at. All of the proceeds of this book actually go into a charity fund as well. And then the book is actually available online on Amazon in an ebook form. So again, it's only $8.99. Please share the link for anybody that needs it as a tool. Again, 100% of the proceeds go into a charity fund that we use to help grassroots organizations achieve a multitude of different things. So we would appreciate your support. Thank you for joining us today. This is Dr. Shanine Cecilian with John North from We Mentor You.